So with touch and pain, there's a few things that we need to understand in order to understand how those senses work. So, what is haptic perception?
Haptic perception. It's a active exploration of the environment, like touching, grasping, and stuff.
Mm-hmm. So it's experience in the environment through touch. So grabbing something or feeling something. Okay? That can also mean through pain, because if we touch something, that's usually how something causes us pain. If I touch the tip of a needle, that causes pain. Okay? So there are a couple theories on that. Whoops, sorry. And the first one is that we talk about the referred pain. So if you had to give me your best definition of that, what would you say?
It's when like internal and like external, they like cross the same thing, telling you like you're feeling pain, sensory like information type of thing.
So you have to both sense it and perceive it. If there is a lapse in referred pain, that's when you get like those guys where the adrenaline was just pumping through them, and like even though they sensed being shot, they didn't perceive it until the adrenaline went away. Okay? Then there's something called gate control theory. If you had to explain that to me, what would you say?
It's a theory that is based on like signals coming from like a pain receptor and like stopping it.
Yes. So gate control, take this word. So the signals come in from pain, but they are stopped. Now the question is, how much pain does that take before we can't stop it anymore? So that's the difference between somebody with a low pain threshold and a high pain threshold. People with low pain thresholds, it takes very minimal signals coming in before it breaks the gate, before the gate cannot be controlled. If we have a high pain threshold, then the gate is controlled extremely well, and it takes vast levels of pain to break down that gate.
Everyone's different when it comes to pain.
Yes, so you could get a paper cut and be totally fine, and I could get a paper cut and be acting like I just got my hand sawed off. It's about pain threshold. It's not about being a drama queen, although sometimes that's true too.
Why is it like sometimes people can accept like bigger pain, like a broken arm or a leg, or like blood gushing out, versus like a little cut on their finger or something like that?
It
is
depends
more painful for them
on those receptors. So it depends on their haptic perception. I mean, sometimes they might feel pain more in their hands than they would in their bones, which is weird, but it does happen. Okay?